I'm Kerry Fink, and welcome to Helping Seniors Update. Today is the 25th of December, and for those of you celebrating, Merry Christmas. But in all cases, I hope you're having an enjoyable, fun, and safe holiday season as we come towards the end of 2020 and start looking ahead into 2021. And so, as we do every other Friday, we have the privilege of sitting down and speaking with Vicki Moore with Humana and CarePlus, who is the host of our special feature we do every other Friday called The Art of Healthy Living. How are you today, Vicki?
I'm doing great,
Is
Carrie. How
your
about
Christmas
you?
going well?
It is. I'm going to have an interesting Christmas this year. We're not doing a traditional Christmas at home, which may seem a little strange right now, but we are going to be traveling and to see family that we've never got to meet before. My daughter recently got married, so I get to meet her new husband. So,
Oh, that's exciting. Well, I hope
yes.
you guys will have a great day on today and an enjoyable time. And I'm so excited about where we're headed in this series that we do together called The Art of Healthy Living. This is drawing on all the resources that Humana puts together. We've had some great talks along the way, everything. We've covered some important topics, I think, such as understanding Medicare and even some talks about Social Security. All these are archived on Helping Seniors of Brevard. We've also had some really good health tips. I think the last one we did was 10 tips for boosting your energy, and that's important as we go through this holiday season. But today,
Exactly.
Vicki, we're going to dive right into partnering with your doctor, which seems tremendously important.
Right. It's a great timing for this topic because we just came out of our AEP, that annual enrollment period, and many people out there are going to be getting new doctors. And so this is, I think, really timely
Yeah.
information. Because with those advantage plans, you have to choose, well, if it's an HMO, you have to choose your primary care doctor. And you'll want to do the same thing with the PPO. And no matter what type of plan you have, it's important information.
Yeah.
So what we're going to talk about today, though, our agenda is our topic is partner with your doctor. And so when it comes to your health, you can't afford to stand on the sidelines. It's important to be an active part of your healthcare team by talking with your doctor about important ways to improve the quality of your life. So today we're going to learn how to do that. So we're going to discuss the importance of good communication. So our agenda today is the importance of good communication, different types of healthcare providers, how to identify your patient personality, how to disagree with being disagreeable, and how to make the most of every doctor's appointment. All right, so partners communicate. Do you ever leave your doctor's office feeling confused about what to do? Have you felt rushed or like no one has the time to listen to what you have to say? Some doctors talk quickly and some use big words that you may not understand. Your appointment seems to fly by very quickly. By the time you get home, you're wondering, what do I need to do? I know that's definitely happened to me before. So the way that patients work with their doctors has changed a lot in the past decade or more. Um, what are some ways that you've seen change? Or I guess what I'm asking is, in the last, since the 70s and the 80s, I think a lot of us definitely can remember back that far.
Oh, yeah.
What did it look like, seeing your doctor then as compared to now? What are those? It's different. It's the way they work with us is different. Um,
Oh, yeah.
So, Carrie, what about you? Have you seen a difference in how, back then versus now when, appointments with your doctor and how you interact with your doctor?
Oh yeah, totally, right? Because of I think it has a lot to do with the advent of computers and things like that because now, and I don't know how it is where what your experience is, but a lot of times it seems like the doctor is sitting there inputting or referencing a lot of things from the computer even while he or she is visiting with you and making sure that the records are updated and all that. So rather than it seems as oftentimes rather than just having a chat, there's a lot more data gathering and things going on.
Yeah, I think you're exactly right. And there, yeah, all that technology is definitely a new aspect to your doctor's appointment. Um, so today, though, a good patient-doctor relationship is more of a partnership. So that's even like a whole nother aspect of this. One of the most important elements of a good partnership is communication. In fact, the National Institute on Aging says how well you and your doctor talk to each other is one of the most important parts of getting good health care. This may mean asking questions, bringing up problems, even if your doctor doesn't ask, and letting your doctor know if you have concerns about something. Just to make sure we're all clear about the importance of good communication, let me share a brief example. Let's say that there's a patient named Chris who finds out at his doctor's appointment that he needs a certain medicine. Chris's doctor prescribes the medicine. Chris fills the prescription, but reads later about some of the bad side effects that he might get. So Chris never takes the medication and he gets really sick. So in this example, there could have been much better communication between Chris and the doctor. Um, so wondering, do you have any idea how they could have partnered better?
Well, it sure
Um,
seems like maybe Chris should have called the doctor back, right? After reading the directions.
right. I think so. I think that was definitely one thing he could have done. I can think of another one as well. So well, on the doctor side of it, probably the doctor should have explained a little bit more to Chris what possible side effects may happen. That way, he wouldn't have felt, I guess, so nervous or scared and had to feel like he had to look it up on his own. So that could have been one way, one form of communication. And then, of course, just like you said, Chris should have or could have called the doctor's office to ask, I need a little more information, or what could side effects be. So that's just a small example, but imagine, or I'm sure it does ring familiar with a lot of you guys out there. I know I've definitely left the doctor's office with questions that I didn't get answered before. So for sure. So the bottom line is, though, when a doctor and patient works as a team, they are more likely to achieve a better health outcome. So we're going to talk about tips for a good doctor-patient partnership. So I'm going to share 5 tips for good doctor-patient communication. These tips can help you focus on both getting and giving information the next time you see your doctor. And we're going to call it the top 5 countdown for the doctor-patient partnership, since it's a countdown. So let's start with number 5. All right, so number 5. On our countdown, find the right doctor. Your primary care physician is often considered to be your main doctor. Remember, the first P in PCP stands for primary. So what are some words that come to mind when you think about the word primary? Dictionaries use terms like chief, principal, main, and first. The primary care physician meets all of these definitions. This man or woman should be your first person to rely on to coordinate all of your care. You may see specialists like a cardiologist or a rheumatologist as well. And as important as they are for your healthcare, their focus is on very specific conditions, whereas the PCP looks at you from a more general perspective. So the PCP is the one who may make sure that you get all of the screening and the vaccines that you need. For example, PCPs can help you find the other experts that you need to see and go visit. And their office is where all of your records from all of your specialists can be all there together. So in one place. That gives your primary doctor a great picture of your overall healthcare and your healthcare needs. What types of doctors are PCPs? They could be internists, they can be family doctors, they can be gosh, I can't say this word today, gerontologists, they can even be OB/GYNs. Each of these doctors can be different or can be as different as each of their patients are. So think about the different doctors you go to. Are there many similarities among the ones that you like best? Would anyone like to share? Well, Carrie, you're right there with me today. Would you like to share some of the characteristics of one of your favorite doctors?
Well, I think you want a doctor that will, number one, listen to you. So when you're describing what your concern is, or a question that you may have, that that person is really giving you not only the benefit of their wisdom that they know medically, but also that they're understanding the question, or what it is that you're trying to get a little better grasp on. And I think that's so important. It goes right back to finding somebody that you feel comfortable with, that you're not intimidated, like your example of Chris, where at least they would feel comfortable enough to call back to the office and say, hey, I got home, I'm reading this, what's a better way to deal with this, because I'm not sure I can tolerate this particular medicine.
Right, right. Yep, very true. And if you don't have a PCP and you're not or if you're not happy with the one that you currently use, it may be time to find a new doctor. And starting, like I said, with a lot of people starting with new doctors on new plans, January is a great time to do that.
Yes.
So when choosing a doctor, it's a good idea to consider which qualities matter most to you. For example, is it important that your doctor's office be close to your home? Do you care if your doctor is a man or a woman? Is it important that your doctor is associated with a specific medical center or hospital? And I will tell you, those are all super important questions that I deal with every single day when I'm working with my Medicare members. Those are the questions I'm always asking when we're helping to choose a new doctor for them. And a lot of people, there are a lot of people that like a specific gender. And there's a lot of people that just want proximity to their home. But of course, the other factors, the communication, all that's important too. So lots of things to think about. You should also ask questions to learn about the doctor and their office staff. Find out about the doctor's education and his qualifications, whether or not they accept Medicare, or are they covered by your insurance plan, and their office policies and their payment procedures. Pay close attention to the office staff, because they are going to be an extension of the doctor, and you will likely have to communicate with them often. And so that's something I hear a lot, just talking to people, about Medicare and about their doctors. And one thing I hear a lot from people is, I really, really like the doctor, but maybe their staff isn't as friendly as I would like. Or it can be the opposite of that. Sometimes I hear, well, I love the office staff, but the doctor doesn't spend as much time with me. So it really is almost like interviewing your doctor and the office to be sure it's a fit that you're comfortable with. So these are some questions that you can ask. What days and hours does the doctor see patients? How far in advance do I have to make appointments? Those are also big questions I help people answer every day. I know there's a doctor's office here. I'm not going to name names or locations, but they're open, I think, 7 days a week. So, if you're somebody that works through the week, that would be a great office for you to be a part of. And, I've got some doctors that I know are months out for an appointment, where I've got some that can see you the next week. So those are, definitely important calls to make to see what that time frame looks like in those offices. Once you've identified the most important qualities to you and learn more about the doctor and his or her office staff, be sure to select a doctor that you can work well with. If you are not satisfied with the information you receive, keep on looking. Who's who at the doctor's office? Before we move into tip number 4, I want to take a moment to talk about who's who at the doctor's office. So when you go to the doctor's office, you want to take a moment to read the name badge, see who's taking care of you. Is it an MD? Is it a DO? These initials refer to the doctor's credentials. They indicate the type of medical school the doctor attended and the licensing exam they took to become a doctor. MD, I think most of us know, stands for medical doctor, and is the most common type of a degree earned by doctors who practice medicine in the United States. DO stands for Doctor of Osteopathic. And we're seeing that, I feel like, a lot more than we used to. So Doctor of Osteopathic Medicine, These types of doctors tend to focus on the whole body when treating medical problems. The biggest difference between the two is philosophy. DOs take a more holistic approach to treat patients compared to medical doctors. So we talked earlier about how the doctor's office has changed. There's no longer just one nurse and one doctor in an office. There are many others, some who might take your blood pressure and weight or draw blood samples, for example, but there are other medical professionals who can practice medicine when working as part of a doctor's practice. So another one that you see a lot is the NP. That, of course, stands for nurse practitioner. And I think most offices these days have a nurse practitioner in their office. These are registered nurses who have additional training in medicine, and most have a master's degree as well. NPs can prescribe medications. You're also going to see RNs, registered nurses. They have graduated from a nursing program, they've passed a state board examination, and they are licensed by the state. And I know because, like I said, I deal every day with my members who oftentimes are telling me about their trips to the doctor's office and things like that. And it seems like it's getting people are more and more comfortable talking to their PA or their nurse practitioner than they used to be. I used to get more people saying, well, I really want to talk to the actual doctor. But nowadays I'm hearing that people are really, a lot of people have a trusted relationship with their nurse practitioners and their physician assistants, which, by the way, a physician assistant is another type of healthcare professional who's in a lot of primary care physicians' offices. So after they get their college degree, they go through a 2-year PA school, and then they pass their national exams. Plus, they have to meet state requirements like nurse practitioners. They can provide a broad number of healthcare services when they work with a doctor. Besides performing regular medical exam, a nurse practitioner or a physician assistant can order labs and tests and x-rays. They can prescribe medications and schedule other therapies too. You might be more likely to see your NP or your PA during your regular office visits, just like I was saying. But he or she also sees people with common illnesses like the flu or an injury like a sprained wrist. NPs and PAs always have access to a doctor if they have a question or if you have a question. And one final note on that is if you get to your appointment and you meet with your NP or your PA, don't be afraid to ask to see the doctor if you like to, because you have every right to do that. You can request specifically, you should be able to request specifically who you want to see. But I, like I said, I do feel like the NPs and PAs are very, very knowledgeable and play a vital role in doctors' offices these days. All right. So now we are at tip number 4, prepare for your visit. It can be difficult to cover everything you need to talk about with your doctor. You may feel rushed or flustered and end up leaving your appointment disappointed you weren't able to get the information you were hoping for. In order to get the most out of your doctor's appointments, it's important to have a plan and be prepared. To do this, make a list of all of your concerns in order of priority. This is everything you want to discuss with your doctor. And it could include a new symptom that you've been experiencing, a question about particular screenings or vaccines, concerns about how a treatment is affecting your daily life. If you have more than a few items to discuss, put them in order, of importance, and then you want to bring that list with you, of course, and don't wait until the end of the appointment to bring these things up. You want to do it right away because you want to advocate for yourself. You want to be sure, you don't, like it said earlier, it should be a partnership. I mean, the doctor is going to have particular questions he's going to ask you, but you definitely want to advocate for yourself and make sure you're getting questions answered. So right up front at the beginning of the appointment, share your questions, ask your questions and everything that you need to do. It's also important to bring everything you may need with you. This could include your medications, your medical records, the names and phone numbers for other doctors that you see, and your insurance cards. And this is especially true when you're going on that initial screening appointment with a brand new doctor. You want to make sure you do that for sure. Some doctors suggest you bring all your medications, your prescriptions, over-the-counter medicines, and vitamins and supplements in a bag. Others prefer you bring a list of everything you take and the dosage. Have that all written down. So obviously you just want to check with the office maybe beforehand when you're making that appointment to find out what they need or want. You may also consider bringing a friend or a family member to your appointments. This can be helpful if you often forget what you wanted to discuss with your doctor, which I've definitely done that, or if you have a hard time remembering what your doctor said afterwards. He or she can take notes for you. Lastly, request an interpreter. If you need to see the doctor you selected or referred to, and they don't speak your language, or maybe a second language, or maybe you're hearing impaired, you can call the doctor's office ahead of time and ask for an interpreter. And I actually just did that recently on an appointment. I had a member who was deaf, hearing impaired, and so at the initial my appointment, getting him enrolled into a Medicare plan and explaining, how that all works. We had an interpreter there, and then I assisted him in getting his first appointment with his new doctor, and we set up an interpreter for that doctor's visit as well. And so I think for that particular office, that was the first time they've done that. But you have every right to have an interpreter there because, your health, of course, is so important, and you want to make sure you're understanding everything that's happening, in those appointments. All right, so now we are at tip number 3, share with your doctor. You are an important part of your healthcare team, and your doctor relies on you to share information about your health. This often includes talking about how you feel physically, mentally, and emotionally. Knowing what to share and how to share it will help you to become a good partner in your healthcare. There are a few things you may need to share with your doctor: symptoms you're experiencing, information about your medications, and your honest report about your lifestyle habits. Let's talk more about each of these. So when you're sharing symptoms with your doctor, keep it clear and concise. Examples of symptoms include pain, fever, a lump or a bump, unexplained weight changes, or having a hard time sleeping. These may be evidence of a disease or disorder in your body. Make some notes about your symptoms before your appointment. Include what you're feeling, when it started, how it affects your daily activities, and what makes it worse or better. Your doctor also needs to know about all the medicines that you take. This includes your prescriptions, your medicines, your over-the-counter medicines, herbal remedies, or supplements, which, we've already kind of talked about that. But make sure you tell your doctor how often you take each one. And describe any drug allergies or reactions that you've had. And lastly, but not least, of course, tell your doctor about your lifestyle habits. Knowing what your life is like will help your doctor provide the best care. Your doctor may ask questions about what you do each day, where you live, how you sleep, if you smoke, if you drink, what you eat, and how much exercise you get. So sometimes these might be hard questions to answer, maybe information you don't want to share, but you really do need to be open and honest about your habits so that the doctor understands your medical conditions and is able to recommend the best treatments for you. All right, so tips for making the most of your time with your doctor. You may not get to have as much time as you hoped or would like, so it's important to make the best use of the time that you do have. So you want to be honest. You may be tempted to tell your doctor what he or she wants to hear. For example, that you exercise or you eat a balanced diet more than you really do. But this isn't going to be in your best interest. Your doctor can help more if he or she knows what's really going on. So you want to choose questions, or you want to choose which questions are most important. Remember that list of concerns we talked about during tip number 4. It's possible, depending on how many concerns are listed, that you won't be able to discuss everything you want with your doctor. So maybe pick 3 or 4 questions or concerns that you most want to talk about with your doctor, then discuss each in turn. You can go on to the other questions if you have time. Because as you know, doctors have a schedule. So I guess depending on the doctor, they allot so much time for you. So you want to make the most of your time. And along those same lines, you want to stick to the point. Keep in mind that each patient is given, that limited amount of time. And so you really want to be as concise as possible. For example, share a brief description of your symptoms, when it started, how often it happens, and if it is getting better or worse. Remember, your doctor may not be able to answer all of those questions. Even the best doctor may be unable, but they may need to find more information for you and maybe even refer you to a specialist. All right. I think so far these are pretty good tips. We are now down to number 3. Share with your doctor. Sometimes sharing personal information with your doctor can be hard. You may feel embarrassed or uncomfortable, but in order to have a good partnership with your doctor, you may need to talk about some sensitive subjects. These sensitive topics may include memory loss, fear of falling, depression, incontinence, which is the loss of bladder control, family problems, and sexuality. At some point in your visit, the doctor is likely to ask something like, how are you doing these days? Or is there anything you'd like to talk with me about today? The forms that you fill out when you first arrive might also have a chance for you to share that information. So these are your chances to talk about any of these concerns. If you think about them ahead of time, you'd be ready, you can be ready with your answer. For example, if you found that you have had some bladder control problems, you could try a conversation starter like, it seems as though I'm always going to the bathroom, or I get frustrated because it seems I can't even or ever empty my bladder. If you don't feel steady on your feet as you used to, a conversation starter might be, I find myself holding onto walls and chairs when I walk, and I never had to do that before. It may also help to use a brochure or booklet as prompts to introduce topics that you may feel awkward or uncomfortable discussing. A good doctor will take your concerns seriously and not brush them off. If you feel like your doctor doesn't take your concerns seriously, it might be time to look for a new doctor. All right, so we are now down to tip number 2. Get the information that you need. We talked about sharing information with your doctor, but it's also important to learn from your doctor by asking questions and listening to what he or she has to say. You can start by learning about medical tests. Your doctor may order a medical test for a variety of reasons. Sometimes they are used to determine what is wrong or to learn more about your medical condition. Other times they are done more regularly to screen for hidden medical problems, like a colonoscopy for colon cancer. Before having a medical test, ask your doctor to explain why it's important, when it will show, and how much it will cost. You should also get instructions on how to prepare for the test. You can also you can ask how long it will take for the results to come in, and you will be notified of the results too. It's also important to discuss your health conditions with your doctor. According to the National Institute on Aging, if you understand your medical condition, you can help make better decisions about treatment. Additionally, if you know what to expect, it may be easier for you to deal with the condition. Ask your doctor to tell you the name of each condition that you have and why he or she, why they think that you have it. You can ask how it may affect you, short and long term, and how long it might last. For some health conditions, your doctor may prescribe a medication. Make sure you know the name of each medicine that you take and why it has been prescribed for you. Be sure to get written instructions for how to take it, including how often and for how long. Find out if there are any other special instructions. Should you avoid certain foods or drinks? Do you need to take the medicine with food or a whole glass of water? Should you avoid taking any other medicines, herbs, or supplements with this particular medicine? And you also want to ask about common side effects, which we've already kind of talked about that as well. Side effects are unwanted or unexpected symptoms or feelings that happen when you take a medicine. Some side effects may make you want to stop taking a medicine, but don't do this without talking to your doctor. He or she may be able to prescribe a different medicine instead, or help you deal with the side effects in other ways. Think about that example we had earlier with Chris. One thing to note is that your pharmacist is also a good source of information about your medicines. Talk to your pharmacist if you need your prescriptions in an easy to open containers or with large print labels. And I know for myself, I have definitely walked out of the doctor's office knowing I have a prescription, but maybe not knowing everything about it. So I've relied on the pharmacist quite often to share some of those, what it does, what it covers, and things like that. All right, so tips for remembering what your doctor says. It's easy to forget a lot of what your doctor tells you, no matter what your age. In some cases, you may get confused about what he or she says. So let's talk about some tips to help you understand and remember what your doctor says. First, ask about anything that seems unclear. Ask questions like, I want to make sure I understand. Could you explain that a little more? You can also repeat what you think the doctor means in your own words and ask, is this correct? If you are uncertain about any of your doctor's instructions when you get home, call the office. Next, you want to take notes. Bring a notepad and pen to every appointment and write down the main points or to ask your doctor, or you can even ask the doctor to write them down with you or down for you. And we also talked about earlier, bring somebody with you if you need to. And if if you have your doctor's permission, you may even think about recording what he or she says. You can also get some extra material. Ask your doctor if he or she has any brochures, DVDs, or other materials about your health conditions or treatments. You can also ask if your doctor recommends any other sources, such as a website or a nonprofit organization that may have information that you can use. And lastly, talk to the other members of your healthcare team. You may get more time with the nurses, the pharmacists, the physician assistants, or the physical therapist. These healthcare providers can help you understand your condition and carry out the treatment plan. All right, so now we are at tip number 1. You are in control. This brings us, this is our final tip. This means that you are the one who makes decisions about your care. So it's important to be hands-on with your health. You and your doctor may need to make some big decisions together, so it's important to be prepared. Over time, the relationship you develop with your PCP will make it more and more comfortable for you to share more with your doctor, including when you disagree with a diagnosis or the best way to treat something. Whether you agree or disagree with your PCP, the open communication keeps you both working together towards the same goal, which of course is your health. Keep in mind, you will benefit most from a treatment when you know what's going on and are involved in making those decisions. So find out about your different treatment options, including the pros and cons for each one. Find out which side effects may occur, how long the treatment would continue, and how likely it is that that treatment will work for you. Last, but certainly not least, learn about prevention and follow your doctor's advice to improve your health. Your doctor may suggest you change your diet, your activity level, or other lifestyle habits to help you stay healthy and deal with medical conditions. According to the National Institute of Aging, up until recently, preventing disease in older adults received little attention. But now we know it's never too late to make healthy changes. If a certain disease or health condition runs in your family, ask your doctor if there are steps you can take to prevent it. And if you have a chronic medical condition, ask how you can manage it, and if there are steps you can take to keep it from getting worse. And this is a really, really important topic. And I do know, for example, with all of the Medicare plans and with Medicare, the preventative things are so important. So take advantage of those. With the Advantage plan, it costs you nothing. They're all zero copays. They should be with any plan that you are on. So you should be able to definitely take advantage of seeing your doctor and having all of your preventative testing and so forth done. All right, so Carrie, with just a quick review here. As you think about all the items on our countdown list, which ones seem most important to you? Just kind of think about that. Are there any here that may be more challenging for you than others? I hope that, you just keep in mind you want to take notes. And also, Carrie, we do have a handout with this presentation. So if anybody out there is interested in getting that handout, would you like to tell them where they can? Well, first of all, you can call me at 321-272-0218. That is my direct cell phone line. I would be happy to answer any questions on Medicare or anything in this discussion today and provide you with a handout. But they can also get it from Carrie.
Yeah, I was going to say, you can also reach us on the Helping Seniors info line at 321-473-7770, 321-473-7770. And our education specialist, Kim Bernard, will make sure that she gets connected with Vicki and that we get you all the correct information. And I think it's really important to take advantage of all this great material that's available. As you know, we also archive the Art of Healthy Living series on our website at Helping Seniors of Brevard.org, helpingseniors.of-brevard.org. You can also, it may be like YouTube, you can click through, and we also put them on our Helping Seniors of Brevard YouTube channel. And we also push these into our Facebook channel. So if you're a Facebook person, like, share, and you can find these there too. So lots of good ways. But Vicki, one more time, if you don't mind, share your number, because you are such a wealth of information and such a help to so many people when they call in and they're asking not only about things that they may have seen on the Art of Healthy Living, but sometimes they just have a question about what's going on or what might be best for them, even in their own Medicare plans.
Which I really enjoy helping people and answering any questions that I can. So yes, my number again is 321-272-0218.
Great. Well, I know it's Christmas Day, so we're gonna bring this thing into a close. Like and share this video. It's great information, particularly is making, I guess now as we put Christmas away, we're going to start thinking about all those New Year's resolutions. And I think learning to talk to your doctor the right way in 2021 is a great one to add to that list. Don't you, Vicki?
I definitely agree. And I also just want to say to everybody out there, Merry Christmas, and enjoy your family today.
Yeah, and you enjoy your family time today. And thank you for all that you do sharing this. We will be back 2 weeks from today on Helping Seniors Update with the next edition of the Art of Healthy Living, where Vicki Moore with Humana and CarePlus is always so kind to share these great teaching tips and things like that. And so until then, hope you have a wonderful holiday week ahead and enjoy your time. Stay safe. We've made it this far with all the COVID precautions. Let's stay that course, and that way we can enjoy 2021 together. So on behalf of Joe Steckler, our president and founder, Kim Bernard, our education specialist, and a special thank you again to Vicki Moore with CarePlus and Humana. Hope you have a great week ahead.